Hi everyone, my name is Dr. Aly Suh, and I'm from Seoul, South Korea at Sungshin Women's University. I apologize for not being able to be there because of the time difference, but I am very excited to share my results today in collaboration with Nanit about parental bedtime procrastination. My talk today is titled Scrolling When Your Baby Sleeps. And if you're a parent, one of the most common advice that you've probably heard is to sleep when your baby sleeps. And research shows that parents lose approximately 730 hours of sleep in the first year of a child's life. However, can we say with confidence that this loss of sleep really is solely because of the child? I want to introduce this concept of bedtime procrastination, which refers to going to bed later than intended, despite knowing that tomorrow is really going to suck, you're going to be tired. And this behavior usually occurs voluntarily without having external reasons such as childcare for doing so. And I don't know if this picture is familiar to you, but kind of lying on your side, making sure your phone is plugged in because you don't want to run out of juice, and kind of scrolling mindlessly. And in modern society, it's really not difficult to find people glued to their phone like this. And the habit of using smartphones right before bed has become increasingly prevalent. And so we wanted to see if this was also the case with parents. And bedtime procrastination is important because it's been studied mostly in association with sleep health. Individuals who engage in bedtime procrastination often end up not getting enough sleep, and they wake up feeling more tired. They wake up in a bad mood. Usually their sleep quality suffers. And we know that not getting enough sleep, especially for parents, can have negative consequences for not only mental but also physical health outcomes. So we had a series of studies before we started studying parents about bedtime procrastination, and I wanted to give you a little bit of background about this. So this was a study that we did in 2020 with 105 young adults. What we did was we wanted to see what young adults were actually doing before bed, whether it was really spending time on their phones. And so we asked them to keep a time use diary for 2 days. It's quite intense. We asked them to log everything they're doing in 10-minute increments, units. And we want to really get into what activities they're engaging in. And this was kind of the result. So it's a little bit busy, but the x-axis here is 3 hours prior to their bedtime. And we kind of divided different types of activities individuals were engaging in. The left side is the low bedtime procrastination group, and the right side is the high bedtime procrastination group. And what we found was that the high bedtime procrastination group spent on average approximately 61 minutes more time per day on their smartphones 3 hours prior to bedtime compared to the low bedtime procrastination group. And if you think about it, that's about 7 hours more per week. We asked them, what are the reasons why you are engaging in bedtime procrastination? They were allowed to answer multiple responses. And the number one response that really came up was that they wanted to escape negative thoughts or unpleasant feelings before bed. Perhaps they had something happen during the day and they didn't quite feel that they were in the right place or the right mind to go to sleep. That one was the most prevalent. The second reason was kind of a sense of self-reward. So they had this day, you worked really hard, and they kind of felt that they deserved to scroll and have this me time. The third reason was also quite interesting in that individuals were seeking some type of social connection with other people. So feeling that they wanted to communicate with others and feel a sense of belonging, they might log onto social media and connect with others. The fourth reason was to obtain useful information, and the fifth was to fall asleep more easily. So from these results, we felt that if we could address some of these reasons for engaging in bedtime procrastination, perhaps we could try to attempt to decrease bedtime procrastination as well. So We wanted to look at to see whether bedtime procrastination was also prevalent in parents for a couple of reasons. Based on prior research, we found that parents of infants and young children have the least amount of leisure time and the lowest levels of leisure satisfaction based on how old their child was or what child developmental stages their child was. And because of this, we felt that parents of children may be more vulnerable to bedtime procrastination due to stress from parenting or having limited leisure time. And we felt that we should focus on bedtime procrastination among parents because after the birth of a child, this is really a period where parents experience a reduction in sleep duration and an increase in fatigue. I'm sure if you've been there, you know that you've probably been overwhelmingly tired. And usually lack of sleep and increased fatigue in parents kind of develops into this vicious cycle where it kind of prevents you from responding sensitively to your children during the day, and that causes a lot of guilt and a lot of negative emotions that usually come up at night. And so we figured parental bedtime procrastination behaviors were also exacerbating this lack of sleep and fatigue and causing this vicious cycle in parents. So we figured we would try to look into this. So this was a study that was done with 94 parents with children who were aged 6 to 24 months. We collected daily sleep diaries, about 4,000 of them. And the parents were mainly in their 30s. A majority of them were mothers, and the infants were around 12 months of age, about half of them being boys and half of them being girls. And sleep diaries were collected between 2023 to 2025. And what we did was we kind of defined bedtime procrastination as we asked parents to kind of mark when they plan to go to bed and then when they actually went to bed. And this time, kind of in between, was what we defined as bedtime procrastination. And interestingly, what we found was that about 78% of parents reported engaging in some type of bedtime procrastination. So most of them didn't actually go to bed at their intended sleep time. And when we used the 40-minute mark, which was in our past research found to be significant, what we found was that 67.6% of nights were spent engaging in more than 40 minutes of bedtime procrastination. And interestingly, we found that parents don't actually sleep when their child sleeps. So when we logged the sleep of the infant, we found that they slept around 10 hours in total in our sample, but the parents were only sleeping 6.3 hours. And we also looked at wake after sleep onset. So anytime spent awake after sleep, after they start sleeping, what we found is that it didn't really differ that much as well. So it wasn't really the child that was keeping the parents up. And there was something else going on in terms of why the parents weren't sleeping as well, which we found to be parental bedtime procrastination. So we wanted to see what was causing parental bedtime procrastination. So this was also a kind of a follow-up study that was done in the US. It was a survey study with parents who had children between the ages of 0 to 24 months. And the parents were mainly mothers, average age around 30 to 34 years. About half of them were boys and mostly around 1 year of age. And what we did was we collected various information from the parents regarding their sleep, their child's sleep, and their psychological states. And what we found was when we plugged in all the factors of interest that might be associated with parental bedtime procrastination, what we found was that these were the factors that mattered the most. So the number one reason was insomnia severity, so not being able to sleep despite wanting to. And also emotion regulation, smartphone addiction, feeling that they're ready to sleep, desire to be alone, income, which might also be associated with getting good help or associated with childcare, feeling like they deserved it, feeling rewards, how young or old their children were, what the nighttime sleep stretch of the child was, and postnatal depression. So among all these factors, the only ones that were really associated with the child were the age of the baby and the nighttime sleep stretch. And all the other ones were somewhat associated with psychological or social factors associated with the parent. And so I really wanted to talk mainly about the first two, insomnia severity, emotion regulation, and also desire to be alone, because it's not a factor that we really talk about. So in terms of insomnia, insomnia, especially diagnosable insomnia, is defined as having persistent sleep complaints, usually difficulty falling asleep or staying asleep or waking up too early in the morning. And you're having these sleep complaints despite having adequate sleep opportunity, which is interesting because in a study with first-time mothers, what we found was that when this study tracked these mothers from during pregnancy until their postpartum, and what they found was about 16 to 19.8%. So about 1 in 5 mothers who were diagnosed had diagnosable insomnia disorder during pregnancy, and when they gave birth, the woman that actually met insomnia criteria were about 5 to 11%, so a little bit lower. But when you actually kind of think about this adequate sleep opportunity definition, when they actually considered that, so even if in mothers who didn't have adequate sleep opportunity, what we found was that about 20 to 40%. So maybe about 1 in 2 mothers to 1 in 5 mothers met the criteria for insomnia, meaning that they needed professional help to actually deal with their insomnia. So kind of looking at this, we know that insomnia, not being able to sleep, is quite important in association with bedtime procrastination. And if you think about why that might be, we talk about really the more positive aspects of being a parent more often than the negative aspects. But this is a 3P model for insomnia that's widely used to explain why individuals might develop insomnia. It's called the 3P model because we explain it with 3 factors that start with P. So before you have insomnia, you have these predisposing factors that might be genetic factors or family history factors, but that in and of itself doesn't really take you over the edge and give you insomnia. Usually, what happens is that you have these precipitating factors, which are usually we defined as stressful events or major changes in life that actually kind of onset insomnia. And if you think about it, being a parent can be quite stressful. And I wanted to kind of follow that up with a really well-known stress study where there were these 2 stress researchers called Holmes and Rahi. And what they did was they compiled a list of stressful events, all stressful events that any individual can experience, and kind of rank them based on how stressful it would be for a specific person. And really interestingly, pregnancy came up as number 12, and gaining a new family member, so giving birth or adopting a child, came up as number 14. And based on these were actually higher than going bankrupt or losing a friend to death. And so we can imagine that actually, having a new family member and, giving birth, being pregnant, all these things are quite stressful that might actually contribute to not being able to sleep. And we should take it a little bit more seriously and really address the stress within the parent's life. The second thing that is kind of related that I wanted to talk about that contributed to parental bedtime procrastination was emotion regulation difficulties. And so emotion regulation is simply how we manage and respond to our emotions, especially strong negative emotions like anger or sadness, fear, regret, which is quite prevalent a lot when you're raising a child. So For example, if your child spills juice all over the floor and you've already had a really long day, you haven't been getting really good quality sleep, you might feel really frustrated. You might want to act out, but instead of acting out, you remember that your child is just a child and they didn't do it on purpose. You take a deep breath, you calm yourself down, and you mop the juice up. So that's kind of emotion regulation in action, kind of acknowledging your feelings, pausing to think, and then maybe responding in a way that aligns with your values. And a lot of the times when you don't get enough sleep, research has shown that emotion regulation can be quite difficult. So you kind of find it difficult to manage or cope with situations in the ways that you normally would. Um, and here are some common things that might be common ways of regulating your emotions that might be associated with parental bedtime procrastination. So, kind of avoiding any strong emotions, such as, I don't want to think about how my younger one keeps hitting other kids at preschool. I'll just watch one more video to stop thinking about it. So, kind of like avoiding thinking about a negative emotion that has come up, or being impulsive. So you know that you should get that sleep, you know that your sleep hasn't been good the past couple of days, but kind of engaging in late night doom scrolling despite being tired and not being able to stop, or even feeling like you deserve it, feeling the sense of reward. So this is my only me time, and I know I'm going to be tired tomorrow, but I deserve this. So this is also these are just some examples of how emotion regulation difficulties might contribute to parental bedtime procrastination. And the third factor that I want to talk a little bit more about is desire to be alone, but not being lonely. It's a factor that's kind of become more discussed about after COVID-19, and it's actually not a factor that we talk a lot about in terms of with in association with parental sleep. It's defined by how much a person desires to be alone. Everyone can be different. Maybe you need just a little bit of time. Some people need a lot of me time. And often in feeling frustrated by the lack of not having enough alone time. And it reflects their need for solitude, but it doesn't necessarily mean that you're lonely. And so having this desire to be alone can kind of be seen a little bit like a trait. You can have a little bit of it or a lot of it, but it does need to be fulfilled in order to, make social connections or feel less stress. And what we found in terms of parental bedtime procrastination is that, one of the things we could really think about is prioritizing alone time. And I know this can seem quite selfish if you have a child, but really thinking about how to prioritize activities which you can do alone each week, maybe even branching out to social support networks, and also this feeling of needing to be alone can feel interrupted by external demands, which, as you can imagine, is quite the case when you have younger children. So other demands too often take away chances for me to just be alone. I'm sure you've heard of stories where parents have locked themselves in the bathroom just to take a second to be alone. And also, not only just is the physical perception of being alone important, but also the perception of feeling that you don't have that alone time, that it's not sufficient. So feeling like you never seem to have enough time for yourself. So really kind of opening the conversation that this need for alone time has become really important, and we really don't talk about it a lot in terms of in the context of parents. So bedtime procrastination may be a bedtime behavior that is an attempt to reclaim that me time, which makes sense, but also, it comes with consequences. So understanding the importance to address whatever needs that are contributing to bedtime procrastination, to kind of address them during the day so that it doesn't really pop up and you don't feel the need to engage in that behavior at night when you need your sleep. And maybe utilizing social support networks. I'm sure a lot of parents have fallen into this trap, but feeling guilty about taking time for your self-care and mental health is important. Research has shown that this need for alone time is very important in terms of long-time childcare and long-time good childcare, positive childcare. So in summary, our research found that parents sleep about an hour less than the average adult, but it's not necessarily solely just because of their children. We found that about 78.6% of parents engage in bedtime procrastination, with about 67% delaying sleep for 40 minutes or more. And really understanding some of the underlying issues that lead to higher likelihood of bedtime procrastination. So some of the ones that came up in our study was stress, insomnia, emotion regulation, a need for alone time. These are all really were all really important contributors to a higher likelihood of bedtime procrastination, and these seem to be important for getting better parental sleep. So, parental bedtime, in conclusion, beyond nighttime caregiving, does seem to contribute to shorter sleep. And hopefully, we can be able to look at this phenomenon and look at what we're missing in terms of how we can help parents a little bit better and support them and hopefully get better sleep. Thank you so much for listening to my talk. And if you have any questions, feel free to email me. I'd be happy to answer any questions that you might have. Thank you very much.